oh, honey, you better make sure that you find a rich husband when you grow up. And this was like, I don't know, 77 or something, 1977. I said, I don't need to do that. I'm going to be a doctor. I'll be able to afford whatever I want myself. And that was really when it crystallized for me that I was going to be a doctor. And becoming a pediatrician then was when I was in medical school. I actually got admitted to a program right out of high school that was a combined medical school undergrad program. Didn't have to go through the whole competitive, beat each other up undergrad experience. I was already admitted to medical school out of high school and at Michigan. And so I had the luxury of enjoying my undergraduate experience in a different way. I majored in psychology as an undergraduate student and could really explore life that way. And in my rotations in medical school, I realized that I was curious about a lot of different aspects of medicine, but when it came to understanding who are my people, like which doctors really are my people, pediatricians were the people I wanted to hang out with. They, were the people who were most attractive to me personality wise. And I do not regret 1 minute my decision to enter pediatrics, both for the types of patients that I care for regularly and the colleagues that I get to interact with throughout my career.
I have to ask, I wonder what role your two brothers played
Mm.
in your tomboyish, strong character.
Yeah, I was the oldest in my family, and they certainly were very different, my brothers and I, just by our natures. I had one very sports-oriented brother, and I have another brother who is very creative and brilliant-minded, not sportsy at all. We're very strong personalities, all three of us. Don't try to get in an argument with any of us. Like, we'll talk you down forever. Like, we'll never stop talking. And but we're also just passionately attached to one another in this beautiful way. And we had a difficult childhood. Our parents were challenged to live with in lots of ways. My mom had type 1 diabetes and was very, very sick quite a bit throughout her childhood, was absent because of her illness in a lot of ways. My dad was he was the dean of the business school at Wayne and spent a lot of time focused on his academic demands. We were fending for ourselves a lot as kids. And I think that created a sort of grit and tenacity that we share and live with even now. It also, though, created difficulties. I think it is part of the reason I became a pediatrician. I wanted to help other kids and families um, avoid some of the difficulties that my brothers and I experienced.
Do you think that made you stronger as a person?
It did for me. I don't think it did for my brothers. They both had some difficulties. They're both recovered alcoholics, have been sober for many years now, but it definitely created real struggles for them. For me, I think because I was the oldest, because I took on the mantle of responsibility in a way that was natural for me because of my birth order. I I became a responsible person at a very young age and carried that with comfortably in a way that also set me up to be creative minded from an entrepreneurial standpoint and also unafraid to take chances and to do things a little differently.
So there's thanks for sharing all of this. This is a
Yes.
wonderful story. But so much to unpack, right? So I always say that autoimmune diabetes affects the whole community. It doesn't affect just the individual that has to live with it. It affects the siblings, the parents, the school bus driver, the teacher, the counselor at the camp. Everybody has to be aware of what's going on with this one child or adult who needs to monitor their life 24 hours a day, 7 days a week. That's a tremendous burden on our society.